Hi, my name is Denise Nichols with Motivate Therapy, and we're here to talk about diaphragmatic breathing. And there's two main reasons. There's lots of reasons to actually diaphragmatically breathe, but the two main reasons that we're going to discuss today is first, that it helps calm the fight or flight response. It allows us to get out of our head and be in the moment. So if you're not thinking about past or future worries, then you are simply being in your body, and that allows your nervous system to calm down, which is healthy for your muscles as well as for your bowel and bladder function. The other reason is that the whole body, we're a four-dimensional container. So your pelvic floor is the base to your house, or the foundation to your house, and if you have a floor, you have a ceiling, and that's your neck and glottal muscles. And then what regulates that pressure is the diaphragm. So my handy assistant here is going to demonstrate diaphragmatic breathing. So the first thing that I want you to understand is that the diaphragm is a dome-shaped muscle right underneath the rib cage. And what happens is when she breathes in, her hands should spread apart, and the weight should rise. All the pressure goes down into the floor, and then as she exhales, everything goes down and gets pulled back up. So she inhales, everything expands, pelvic floor goes down, and as she exhales, the diaphragm shortens and kind of pulls everything back up. Notice how her chest is not moving. So one more time. Hands apart, belly up, and then hands in, belly down. Now show us a shallow chest breath. Notice how her hands get pulled in and her chest rises up towards her face. So the best way to know if you're doing it right is if when you inhale, you feel everything up here tense and your fingers get pulled in, then that's more of a chest breath. We're looking for more of a diaphragmatic breath. So the fingers go apart, belly rises. So it's the same thing as what happens to a balloon. So the air goes in through her top, and then the pelvic floor, the base of it, expands. So more pressure puts the pressure down on the pelvis, and it makes the pelvic floor expand as well as her abdomen. And then when she goes to exhale, the pressure has to change from below to above. So then as the diaphragm pulls everything up, pelvic floor, the pressure changes down here, and then the air goes back up. So again, it's the lungs expanding, shifting pressure, and then everything goes back up. So one last time, she's breathing in through her nose, fingertips expanding, the weight is rising. And then as she exhales, everything's falling back down. She's relaxed, she's not sucking, she's not tensioning, she's not pushing. In through the nose, maybe a 2-3 second count, and then out through either the nose or soft, relaxed lips. So we recommend 5 minutes a day in a nice quiet space where you can really connect with your body and get out of your head and not have to worry about the telephone, things like that. And then eventually, as that starts to feel more comfortable, then apply it through your day. Maybe do a couple of these before you turn the car on, or before you walk in the house to greet your family, or in the middle of a stressful meeting. A couple slow, deep breaths really can make a difference for your health and well-being. Thanks for watching.